So today for the YRBS 101, we wanted to provide an overview of what we'll cover today. We'll review the Youth Risk Behavior Survey purpose, its method. We'll just review some key findings from the YRBS related to substance use, mental health, and protective factors. The YRBS covers many health topics, but for sake of time and interest of this group, we'll limit it to those, but we'll show you how to access the data at the end too. We'll have a brief discussion about how the YRBS is used in Alaska, challenges and opportunities, and then a summary and some time for questions. The Youth Risk Behavior Survey is a school-based survey of high school students, 9th through 12th grade. It's conducted by our department, the Department of Health, supported by the Department of Education and Early Development. It's sponsored by the CDC. There's 3 samples in the survey. There's a statewide traditional high school sample, alternative high schools, and then a district-specific sample. For all samples, whether or not a school participates is up to the superintendent. Andrea will go more over methods in detail in a bit here. And it's a risk and resiliency behavior monitoring system.
So when we talk about risk behaviors and resiliency factors, it's risk behaviors that are linked with leading causes of death actually in adolescence, as well as risk behaviors that are linked with leading causes of death that happen later in life. And then, of course, resiliency factors that can protect against illness, injury, and premature death. So just taking a look at what that looks like, this is the top 3 leading causes of death in Alaska in this specific age group, 15 to 24-year-olds. And the top 3 are all injury related. I think that's probably not a shock to this particular group, but it really is kind of stark when you look at that. 44% being unintentional injuries, 32% suicide, and 8% assault. And that leaves 17% for everything else in that age group. So that is something to look at in terms of that being the causes of death. And of course, we're going to be interested in what the YRBS can measure that's related to that. So that's this. So these are some YRBS behavior measures that we can look at related to those. So there's safety measures, looking at driving or riding in a car while drinking or while the driver has been drinking, or texting, using drugs, helmet and seatbelt use. There's also a number of violence measures. So we look at bullying, whether it's at school or cyberbullying, physical, sexual, and dating violence questions. There's a number of substance use questions, so alcohol, marijuana, other substance use, as well as perceptions of risk. And then, of course, suicide and mental health questions. But again, most Alaskans ultimately die from a chronic disease. So the red bars here are what those chronic diseases are, top 2 being cancer and heart disease. And so because of that, the YRBS is also interested in the next slide. Looking at things like weight status, physical activity, and nutrition. You can see we measure overweight and obesity, consumption of fruits and sugary drinks, physical activity, physical education, and screen time and social media use, and also tobacco use, smoking, whether smoking, smokeless vaping, as well as sexual behaviors. And then we also measure in Alaska factors that may worsen or protect against injury, deaths, and chronic disease. So for example, we don't have the full spate of adverse childhood experiences, but we do get at some measures that get to that. Also positive childhood experiences. So connectedness with school, caring adults and teachers, relationship skills, as well as community engagement and connectedness. So just really quickly, methods. Again, as Jenna said, this is high school, so 9th through 12th grade. It's a probability sample, which really just means the data that we get out when we get the weighted data is representative of the state. And then, so not just the students who took it, but again, representative of the state with some caveats that we can certainly discuss. Bolded there, you see, it's anonymous. When we collect this, there is no information about the student's name or any other identifying information, so completely anonymous, completely voluntary, and a student cannot take it if their parent has not or guardian has not given consent. It is self-administered, again, for privacy, that's important. It's done in a class period. It used to take 45 minutes. Now that we've gone electronic, which happened in 2025, it's actually much less time. And the 2025 YRBS data have been submitted to CDC. A lot has happened in CDC and the federal government this past year, and that has slowed down significantly when we get our data. So we are hopeful we will find out very shortly if we get weighted data. So what we'll be presenting here is the 2023 data. And in terms of how YRBS data are used in Alaska, these are just a few examples. We know that people use them in their grant applications for funding for various programs. We use them at the state, and I know our partners use it for monitoring trends, whether those are things we've been measuring for a long time or emerging trends. The first time we asked vaping, we didn't know what the vaping prevalence was before that. Program planning and evaluation, are the programs that we're doing working? Are they having the impact with the groups that we want them to? And we know many folks are interested in community health assessment, needs assessments. So again, as Jenna said, we're just going to touch on some data in a few of the topic areas. So you're going to see a few data slides here. Just at the top is really kind of a statement of what the slide is showing. The graph is going to show whatever the years are that we have YRBS data. And there's some color coding here. If it's a positive, a significant, and things are improving, whether that's going up or down, the line will be green. If it's going in the wrong direction, worsening, whether that's up or down, it'll be in red. And if it's in blue, that just means there's not a significant trend. So this is looking at percentage of students who are current alcohol users. And so fewer students drank alcohol at all in the last 30 days. So this is a lovely trend that we see, significant trend from 29% in 2011 down to 17% with our most recent data. And this is just to show we have the ability to look at some demographic breakouts. This just shows what you will see with a lot of YRBS measures is sort of this stair step where some of the risk behaviors you see increasingly as the students get older. So this is showing in ninth grade, only around 11% of students say they drank in the last month, and that goes up to 25%. And when we're looking at 12th graders.
And just to mention, in 2021, we didn't conduct the YRBS due to COVID. So there's missing data points there.
So then we also ask about binge drinking specifically, and this is one that's asked a little bit different for males. It's 4 or more drinks at the same time. For females, it's 5 or more. And we see also a decline in binge drinking between 2017 and 2023, down to 9%. And again, that same sort of stair step as you might expect with age and grade level. So this question is asking, just among those who do drink alcohol, what source they got it from. And this is looking at the percent that got it from a store, restaurant, and a bar, which you can see it's very small, which is good. That means our enforcement is working. And in fact, there was the number was so small in 2023, we can't even really report it. So that's good to keep an eye on that and keep that low. But there's really been no change at the age at which drinking starts. So about consistently 15% of high school students say they had their first drink of alcohol before age 13. Looking at marijuana, percentage of students who, now this is a lifetime, so ever tried marijuana has continued to decline. Obviously, when Alaska had some legislation related to marijuana, folks were very interested in making sure that this didn't pop up. With ever use, we are not seeing that. In fact, we're seeing that continue to come down to only a third now with the 2023 data. And this is, again, just breaking out that data by demographic group. So 41% of all students, all high school students, say they ever used marijuana in 2023, more with older grades. And we see a pretty big racial inequity, 47% of Alaska Native American Indian students compared to 24% with white students. If we look at just current marijuana use, so just in the last 30 days, that has been really pretty flat. About 1 in 5 high school students say they currently use marijuana. And again, kind of the similar pattern when we look by demographics. Now, the form in which marijuana is used, this is looking at it was used by smoking. And so that's been shifting. If we compare just 2015 to 2023, the percent that smoke it really dropped down from 88% to 61%. So vaping it has increased and edibles have increased. And then we ask bunch of other questions about other substances. Some we ask ever, Because the numbers are so low, it doesn't really make sense to ask current use on all of these. So this is just showing, these are the percentages whoever used non-prescribed prescription pain medication. So it's prescription pain medication, but they are not using it as prescribed, or it wasn't prescribed to them. So that's the highest at 13% ever, down to inhalants at 7%, and you can see the rest go down. When we compare just from the previous 2019 to 2023, really not a lot of change going on there. Benzodiazepines came down a little bit, and all the current use measures were below 6%. So moving over to the suicide and mental health data that we get from YRBS. This is a set of questions we've asked for a number of years, and it's very troubling to see. These are significantly worsening, increasing trends over the long term, in this percentage felt so sad or hopeless for 2 or more weeks in the last year, that they couldn't engage in their normal activities. So that's gone up significantly, as has seriously considering suicide, planning, or making a suicide attempt. And you can see that's up to, the attempted suicide, 19%. So almost 1 in 5 high school students in 2023 made a suicide attempt. If we look at some of this data broken out demographically, we do see in the most recent 2023 data, girls were almost twice as likely as boys to have that so sad or hopeless for the last 2 weeks more in the last year that they didn't conduct their normal activity. So 57% of high school student females. And then also they were significantly more likely than boys to consider suicide. This was not a significant difference. As you can see, it's nominally larger, in terms of making a plan for suicide. But then once you look to actual attempting suicide, there's no difference at all between girls and boys. So kind of a different set of pattern of results here. In 2023, we asked about anxiety, so not just depression, but anxiety. And fully 1/3 of students had such high levels of anxiety in the last year for 2 or more weeks that impacted their regular activities. Again, higher, significantly higher in girls than boys. Then moving to the social determinants of health and youth resilience measures that we have on the YRBS. Again, in our most recent 2023 data, fully 1/3 of students had experienced food insecurity in the last month alone. And again, we saw some racial inequities there, with Alaska Native American Indian students and those of other or multiple races being significantly higher compared to white high school students. And then we asked in 2023 also about this, sort of not sleeping in one's own home for a variety of reasons. So 1 in 10 students slept away from home in the last year because they were either kicked out, they ran away, they were abandoned, or they felt unsafe in their home. Looking at the positive, the assets, we ask a variety of questions and have for a number of years on the YRBS. In 2023, students feel varying levels of support from these different sources. So the first one you see, their parents talk to them about school every day. That's about 40% of high school students. They have 3 or more trusted adults beyond their parents in their lives that they could go to if they needed support. That's at 45%. Do not feel alone in their life. That's 54%. They engage in some sorts of organized activities, whatever that may be, clubs or sports. It's 54%. They feel they matter in their community. That's a 59%. And I think it's all the teachers should see that the strongest one here is teachers really care. 66% of high school students believe that their teachers really care about them. And this is just a couple of sort of breakouts by some of those assets questions. Like, this is why this is important to ask about protective factors. For example, it's related to alcohol use. So on the left, the bars are showing current alcohol levels, current alcohol use among students whose parents, the student says, my parents don't talk to me daily about school. 19% of them are current alcohol users, and that's significantly more than those who have that parental engagement at 14%. Similarly, current alcohol use among students who do not have those 3 or more supportive adults in their life is 21%, and it's only 13% if they do have that support. Similar for marijuana use. So current marijuana use is higher if the parents are not engaged in talking about school every day with the students, and also if they don't have those supportive adults in their life.
So we know that there are some challenges with the YRBS nationally and in Alaska. Participation rates are declining. In 2025, our school response rate as well as our student participation rates were lower than in previous cycles. Anecdotally, in 2025, we heard from schools about survey fatigue, that students are over-surveyed, staff are overburdened with tasks and responsibilities, and teachers don't want to take away from their instructional time. We heard parents receive a lot of communication from schools, and the active consent and the permission form for the YRBS kind of just got lost. And then lower participation kind of spirals into some of those other areas with concerns about representation. And as we talked about, whether or not a school or a district participates is up to the superintendent. And because of the extra burden for staff and other things that we talked about, some superintendents don't see the importance in the YRBS and might not opt to participate. But with all that, of course, there's opportunities to address some of those issues. Treatment centers can leverage peer recovery support services and use peers with lived experience to normalize the survey process and promote it. Alliances can use their networks to share surveys' importance. Partners can collaborate with the YRBS program about questions and revisions to the survey. For instance, in 2027, the CDC reached out to all sites to provide input into the national survey. We held 3 different meetings to collect our partners' input into what suggestions they had for revisions to the survey. When it comes to Alaska's questionnaire development, we'll be holding partner meetings again. As we talked about, what Andrea shared is just a portion of all the available data that is gathered in the YRBS. So we wanted to walk through our dashboards and show you how to access it yourself. Just a little note about our dashboard. We're working really hard to make it more accessible and have it ADA. Our goal is to have it ADA compliant by April 24th. In that process, if there's any changes with being able to access the dashboard on our website, I'll provide updates through that listserv. We're working hard. We hope there's no changes. For now, you can go to the State of Alaska website, look for search for the YRBS data dashboard, or you can, if you don't find what you're looking for, always email us. When you get to the dashboard, you'll see this page. You start by selecting the topics and school type. So you'll see statewide alternative and statewide traditional. After selecting the school type, you'll go to topics. Here are the various topics available on the dashboard. You can then select what topic you want to view. Here, for this example, we'll use mental health and suicide. Here we're looking at statewide traditional, mental health and suicide. And here's the piece that sometimes holds people up. The next part is that you need to select the indicator. So once you select this button here where the indicator is, will come all the questions related to mental health and suicide. You pick which indicator you want. For this example, we'll look at percentage of students who attempted suicide. When you select those things, here will come your data. And then below that, it's broken down by demographics. And then below that is the data chart. At the top are other helpful links about methodology, how to use the data, view the data. And again, always please reach out to us if you have any questions. Another helpful tip is the survey is also on our website. So if you look at the survey to get an idea of the questions first, and then you can look for the information that you need on the dashboard. In summary, the YRBS is an essential tool for understanding adolescent health here in Alaska. We see some current trends that signal urgent need, especially around mental health. The data can directly inform programs, policies, and resource allocation, and public health partners can leverage YRBS for evidence-based action.